Hello, it's Lindy Royer here, founder of Park Meadows Pilates and Physical Therapy in Lone Tree, Colorado, and creator of the Body Truth program. We're going through a series of indoor golf tips and techniques for you, and today we're going to take a look at the knee joint. Now in golf, the knee is really significant because at address, the knee has to be slightly bent. Most of us think that the knee is what we call a hinge joint, but in truth, it really is not a hinge joint. That's a little bit of a myth. I like to call it a myth conception, actually, because we have all these myths and misconceptions about how our body's designed, and that causes us to operate our body incorrectly. Did you know that the knee is not really a hinge joint? It's really more of a rolling, sliding kind of a joint. More like the way a ball would roll in a little dish or on top of a convex or concave surface. So the bottom of the knee joint, formed by the femur bone, this upper leg bone that I have here with Seymour. So the bottom of the femur bone is actually curved just like this ball. That sits on a joint which is formed by the tibia, the lower leg bone, which is actually curved more like the inside of a bowl or the inside of a dish. So that the way the knee joint moves is by rolling this surface, which is actually like two wheels, on top of this surface, creating a motion that is more like this. If my knee were a hinge joint and I literally hinged, my femur would fall off the back of my tibia. So my femur, my upper leg bone, has to actually roll on top of the tibia in order to create motion. What's significant about the knee is the knee is a little bit like the middle child, right? It sits between the hip at one end and the ankle at the other end, and we looked at the ankle in the last video, and it has to respond to both. So the knee is really more of a response joint. We'll take a look at that a little bit more when we look at the hip in the next video and how that might affect the knee. But for now, just know that the knee rolls and slides. It doesn't actually hinge. So let's have a look at this. I'm going to show you what I want you to do this week or the next couple of weeks to practice how to do that motion. So I'm going to turn to the side. And let's have a look at this motion. So what you're going to do this week is you're going to bend your knees just slightly and imagine this motion of rolling as you bend and unrolling as you straighten. So it looks more like this. As I bend, my femur bone is actually rolling back, and then as I straighten, my femur bone is actually rolling forward. So you could imagine like a wheel sliding, like your car, rolling and sliding as you bend and straighten. The joint itself is about here. So this is my tibia bone, this is my femur bone, there's the joint. The fibula, this little long bone on the outside, is not part of the knee joint. So that's your homework for this week. I'd like you to practice that and just be aware of this rolling motion that happens in the knee joint as you bend and straighten. When can you practice it? Every time you sit down and stand up. That's a great time to practice. If you're practicing your golf stance, also imagine that rolling motion or spinning motion happening as you bend and straighten your knees. I look forward to seeing you in the next video.